Hi, my name is Rachel Kelly, and this is my Teach Me Something for Respiratory. My topic this week is bronchiolitis. So I'm going to start. So bronchiolitis is a condition that affects your lungs. So here you have your trachea. This goes down, splits into your bronchi. You have your two you have your two lungs here, and these are separated into different lobes, but for the purposes of this video. So here we have a rudimentary lung situation. So from here, your bronchi split into bronchioles. So these are your bronchioles. These web all throughout your lung. And this is on both sides that this happens. So your bronchioles all throughout the lung. All right. So trachea, bronchi, bronchioles. Attached to your bronchioles, you have your alveoli. And these little sacs collect oxygen, and they're responsible for, in part, gas exchange. So here, trachea, bronchi, bronchioles, alveoli. So, when someone is experiencing bronchiolitis, for our purposes, a child, bronchiolitis, they're experiencing inflammation of their bronchioles and also their alveoli. And what happens is it's usually a viral infection, but it causes inflammation and mucus to condense in the bronchioles. So, for instance, that would look like this. So instead of this bronchiole being clear, a clear tube there, you would have mucus, creating an obstruction for the airway. And this mucus can also cause mucosal edema. It can be cellular debris. It's it's obstructing gas exchange. It can cause ineffective breathing patterns. These are all potential nursing diagnoses for bronchiolitis, and it can also create fatigue and anxiety, and deficient knowledge can be another nursing diagnosis. So when you're assessing a patient that's experiencing this, you're going to be assessing their cough, whether or not it's exorbitant, whether or not have the frequency, what they're coughing up, what it looks like. You're going to look at the duration and the onset of the cough, and then you're also going to you're still probably going to find diminished or absent breath sounds depending on the severity of the case. This mucus can become extremely debilitating in terms of your respiratory functioning. And you may observe crackles, wheezing, bronchi, and there may be a hacking cough. This could be productive or non-productive. The patient may experience a fever. It is a virus. You are experiencing inflammation throughout your body, potentially, especially in your respiratory system. Dyspnea, tachypnea, and also increased mucus in not only your lungs, but in your nasal nose. So interventions for this, you're going to keep the bed raised at 30 degrees. You're going to change position frequently, every 2 hours. You're going to provide rest periods for this patient. And you're also going to address the issue of deficient knowledge, potentially. You're going to want to make sure your patient is continuing their medication and until it is finished, not just until they feel better. And you're going to want to make sure that parents are aware of how to be administering this as well. A lot of it will be inhaler-based, so you're going to want to make sure they know how to use these inhalers and what they're for. You're going to also going to assist in deep breathing exercises to help try to get up some of that mucus in their lungs too. ease their breathing. A positive outcome for someone with bronchiolitis is a return to normal functioning with effective breathing, effective airway clearance, no fatigue or anxiety, and with sufficient knowledge. You're going to, in severe cases, this could interfere with gas exchange, and that could lead to hypercapnia and hypoxemia, and that could result in respiratory acidosis. So this was my brief Teach Me Something on bronchiolitis for week 2. Thank you very much.